Hello everyone. So this is another video on a reason out type learning. Before that, if you are a postgraduate pursuing MD biochemistry, so if you want a complete guidance, you can click on the link below in the description box and download the app and check out the contents for you, right? Yes. So today's reason out question will be point of care testing in myocardial infarction. So how useful is the point of care testing in myocardial infarction? This is going to be a topic today. So what is first of all point of care testing? So I would call it as POCT in this video, right? So POCT is nothing but point of care testing. So POCT is nothing but it's the testing at the site of patient care, right? It's at the bedside or even at home or in a community site. Yes, so it's a medical testing at the site of patient care and it doesn't need any big expertise. So whoever performs it, yes, it can be self-testing. We ourselves, the patient themselves can perform the test. So the test that is done outside the laboratory, regardless of who performs it, including self-testing. So this is what is the definition of POCT. Yes, so how useful is this POCT in the primary care or in secondary tertiary care? That is, as I already had mentioned you, in at home, community, at pharmacy, healthcare centers, clinic, diagnostic centers, in any ambulance vehicle. Yes, emergency department, ICU, OT, operation theaters, OP clinic, ward, everywhere. You can just use this, right? You can just use these POCT devices to diagnose for any analyte. Yes, to diagnose the patient for measuring or any analyte. Yes. So WHO assured criteria. So any POCT device that we develop, yes, any POCT device that we develop for any analyte must follow the WHO assured criteria. Assured criteria in the sense A for affordable, S for sensitive, S for specific, U for user friendly, R for rapid and robust, E for equipment free, and D for deliver to end users. All right, so this is the assured criteria developed by WHO, and this has to be kept in mind while devising a POCT device. So for myocardial infarction, so that's our topic proper, right? So myocardial infarction is an emergency. Of course, it's a medical emergency condition. Here, you need to give a you need to make a prompt diagnosis, and if you initiate early the treatment early, it would be of huge impact in the prognosis and the life of the patient. Is it not? So the patient will uh, in order to increase the lifespan or to even save the patient, early treatment is very much essential in case of MI. So with POCT, the diagnosis has become easy, fast, and at bedside even, right, at any site. Yes, so instead of you taking a blood sample and transporting it to the laboratory and using an instrument to measure the cardiac markers for the MI, it takes some about time, right? So rather than doing that, if you just have one device in hand and if in nearby the patient, and you can just with the help of even a drop of blood from a finger prick, if you're able to say whether the patient is positive for the cardiac marker or not, then that is going to be of huge help to the clinicians to treat, is it not? Yes. So the cardiac markers for MI that's been commonly used nowadays are the cardiac troponins. Yes, cardiac troponins, I and T, and also we have high sensitivity cardiac troponins. Yes, also CKMB. So, but even if we have these cardiac markers will increase in the blood only when the concentration of which will increase in the blood after 4 hours of the onset of symptoms. Yes, so in that case, only after the concentration has increased, you will be able to POCT or any other method by which you analyze this. If you want to estimate this, it will be only after few hours, like 4 hours after the onset of symptoms, that you will be able to identify the cardiac markers. So this POCT device, if you make it for a single marker, okay, fine, that is also useful. Or if you make it for a panel of cardiac markers, then of course that will be double useful, is it not? For prompt diagnosis, so that you can initiate the treatment sooner. So types of POCT that you can have a small handheld device. Yes, small handheld device, single use device, right? And also you can have a small handheld single use device with a monitoring device. And also you can have a large cartridge type or benchtop POCT devices. These are the three types of POCTs. And a POCT device can incorporate many different methodologies. Okay, methodologies, I mean to say it can use a immunoassay, yes, or any optical techniques, electrochemistry. So based on fluorescence, yes, so based on any of these methodologies can be incorporated in a POCT and it can be used. So one such example that I am going to explain to you is about the lateral flow immunoassay, right? Lateral flow immunoassay. So if you just look into this picture, yes, look into this picture. So what I'm going to do is this is the application zone onto which I'm going to place a drop of blood. Right, I'm going to place a drop of blood. That is the sample. So in that sample, I'm going to estimate whether the cardiac troponin T is present or not. Yes. So after I place the drop of blood, the drop of blood flows through the glass fiber fleece here. Yes, glass fiber fleece here, and in which area the plasma gets separated. Right, it separates the plasma. Also, in the reagent side, what do you have? In the reagent side, you have two monoclonal antibodies to the cardiac troponin T. One is a gold labeled antibody, the other one is a bioattenuated antibody. Yes, one is a gold label antibody, the other one is a bioattenuated antibody. So you have in the reagent, you have these two monoclonal antibodies. And in this area under which you have applied the sample, yes, the plasma is being separated. Now what happens? This is a lateral flow immunoassay, is it not? So now the complex of the sample and your monoclonal antibodies are now going to flow in the lateral direction along the solid phase strip. Yes, along the solid phase strip. So it is going to flow in the lateral direction. So as it flows, what happens? Into the cardiac troponin T, to the cardiac troponin T, you have the gold label antibody. Also, you have the bioattenuated antibody. So, this cardiac troponin T gets sandwiched between these two antibodies. So, in this area, what happens? The sandwich complexes are being formed. After which, you're going to detect these sandwich complexes. So, how do you detect this? This is the signal area. Yes, this is signal area in which you have the streptavidin. So, this streptavidin to the streptavidin bioattenuated antibody binds, right? So this sandwich complex is fixed here. As the sandwich complex is fixed, this signal will be detected here. Yes, we will be able to find a line, positive line in the strip. Right. So also you should know whether the device is working properly, whether the sample has flowed till the end. Yes, whether the sample and the complex have flowed till the end. So for that you need a control line. Yes. How do you find this control line? The gold labeled antibody that are free will flow till the end, and that is captured by a synthetic peptide, and then you get another control line. Yes. So in this strip, this is going to be a strip. So how is this strip going to look like now? Yes, this strip is going to look like this. And this area is open in which you are going to apply the sample. And all of the reaction phase is going to be covered. Yes, all of the reaction phase under which you have the solid phase matrix that is going to be covered. And you will have one area exposed here, wherein you get one, this is a control line, this is the test line. Yes. So if you have only the control line, then it means that the sample is negative for the cardiac troponin T. If you have the test line also, yes, if you have two lines, only then it means the signal is developed. No, because of the sandwich complex that is formed by the cardiac troponin T and the monoclonal antibodies. Is it not? So if you get two lines, then it means that the test is positive. The sample is positive for cardiac troponin T. So if you get only a single control line, then it means that it is negative. So this is how you read this strip. So this is a POCT, is it not? So you get the result within minutes, right? So this is a lateral flow immunoassay based strip. So look into this. This is the strip that I was talking about, right? So you have, if you get, there is a sample, there is the area on which you apply the sample, yes, and you have the area in which you find. If you find two lines, then it means positive. If you have a single control line, then it means the sample is negative for troponin T. Right. So this gives us a qualitative information, that is whether it is positive or negative. Yes, if you want a quantitative information, then also we have some other. You need a monitoring device. You need a readout device. Yes, you need a reader device. You will need a benchtop device. You will need a cartridge type based benchtop device. Right. So this is one analyzer which is a cartridge based. So you in the cartridge you are going to apply the sample and you're going to give it to the analyzer. Yes, and then you get a value out of here. And even this, so if you look into this whole thing, no, this whole thing, you have the this is single, you have the chip here. Yes, you have a chip here, and this is also this cartridge based in which you're going to apply the sample. This is inverted that has been shown. Yes, you have this radio frequency identification chip that is here. Let me erase this. Yes, chip there. And also the if you're going to insert this part into this handheld device. This is very small. No, it is looking very small. It is small handheld. Yes, it has a readout device also. So you're going to insert this. So after inserting this, you're going to apply the sample here. Yes, you're going to apply the sample here, and within minutes you're going to find out the value. Yes, so these are some few of the in POCTs. Also, you have benchtop devices. Yes, you have large benchtop devices also, and large cartridge based devices also. So that's what I had shown here. And qualitative and even for quantitative estimation, that you can use these POCTs. Right. Yes. And if you see the advantages, what are the advantages of using POCT in MI? Of course, if you can see the central lab testing, it takes so many processes. No, first you have to obtain the venous sample, then it has to be transported to labs, and analysis has to be performed. It has to be verified by the consultants, and then the report has to be issued, and then only the treatment, and then they will decide on the treatment. Rather, if just the clinician has this in hand, has this POCT in hand, he can just obtain the capillary sample, and then on the POCT he can just drop the sample, and he will be able to find out whether it is positive or negative, right? So this is one of the advantage. So it reduces the turnaround time. What do you call it? It reduces the turnaround time. That is one big advantage of using POCTs. And also there is improved patient management. Yes. And also there is improved engagement between patient and caregiver. Yes. And it improves the reduces patient morbidity, mortality rate. Yes. And there is reduction in the work. Yes, administrative work like associated with test requesting, reporting, all these processes are being shortened here. And also it reduces the risk of workflow associated errors. Yes, and it decreases overall cost of care also. Right? Yes, these are some of the advantages. So of course you will have disadvantages. Yes, not every time you can rely completely on this, on the results of this POCTs, and also because you're using for cardiac markers, since we are discussing cardiac troponins and CKMB will not be positive for the first 4 hours of onset of symptoms. Yes, so you can't just make the patient wait. Of course, you have to shift the patient to the tertiary care hospital where the adequate facilities are available. Okay, so yes, these are some of the points that you have to remember in POCT in myocardial infarction. So of course you have what are the different POCTs you have to know, and how is it very beneficial, and also what are the different devices that can be used. Yes, thank you all. See you all with the next reason out video. Yes, bye bye.